and go.
All right, well, thanks all for coming, both here in person and those of you guys online. I'm sure appreciate you coming out. I guess we'll start by introducing ourselves. I'm Laura McKaig, and I am owner of Laura McKaig Physical Therapy, but as of today, changing the name to Pelvic Connection Physical Therapy and Wellness. I'm a one-person clinic in Olathe, Kansas, and I specialize only in pelvic floor physical therapy for both men and women. Been doing it, well, this is my 7th year in business and really love helping people that way.
And I am Trisha McCulloch, and thank you all for being here. So I started the pelvic health program at the University of Kansas Health System back at the end of 2017. And I've actually been treating pelvic health patients for the better part of 12 or 13 years. And at our clinic, we actually have 7 of us in clinic now, and all treat men, women. I also treat transgender patients. So got a bit of experience, and this is actually my favorite group of people to work with.
I'd probably say you've got 2 of the strongest men's health advocates here in one room. And we just really enjoy advocating and educating, because really the main way this is going to go forward, nearly all of the doctors who normally refer to me now heard about it through their patients. So they'll listen to you. And if you find, wow, this is really helping, tell your doctor. And they will listen. So you can make a really, really big impact for other guys.
Absolutely.
Yeah. Well, we're curious here. Just kind of the audience here, we talk about the side effects for prostate cancer treatments, and just kind of curious, you know, who has had what treatments, radiation, hormone therapy, prostatectomy, anything like that. If anybody wanted to kind of share about that, or just.
Sure. Well, I had a prostatectomy a year ago. I'm about to start hormone treatment.
Yeah. Mm-hmm. Anybody who's had radiation?
Yep.
Just me.
All right, yeah. Prostatectomy?
Yep.
Okay.
Recording in progress.
All right, and hormone therapy.
Next week.
Next week,
Yeah.
okay.
What I will say is commonly I tend to see a little bit of all of it. Sometimes it's just prostatectomy, sometimes it's just radiation, and it can be brachytherapy, where they actually insert the seeds into the prostate, or the external beam. And then lots of the hormone replacement therapy, and it can be a variety of combination depending on what y'all and the surgeons and radiation oncologists decide.
All right.
Slides?
Get the discount come on.
Okay.
We put together presentation just to kind of talk about what it is we do, and maybe some things that you haven't heard about, as far as, you know, our passion is bridging that gap. And Steve and I talked about that, oh gosh, quite a few years ago. The gap between, hey, you're done with your treatments. And okay, now what do I do? How do I get back to living life? And there seems to be a huge gap there, and who is filling that? Not a whole lot of people, and not a lot of professionals, and that's one of our passions, is just helping you get back to your best life after the cancer treatments. So there's a thing.
Can you see the slide?
Slide's on.
Got it. So we've already introduced ourselves. We can move
All right.
to the next slide. So I would say doctors saved your life, and to that we're very grateful. We help you get back to living your best life. And we want to broaden this beyond just physical therapy, because there's people who do occupational therapy who help with this. There's specialized personal trainers who work with cancer survivors. There's movement therapists. So really we're talking about more movement-based for fitness therapy that can help with this. Yes, I have a little clicker.
You just pointed at
Yeah.
me.
So the two big things we will probably harp on and harp on all the time. Pelvic floor therapy is more than Kegels and biofeedback. For those in the back, it's more than just Kegels and biofeedback. Yes, those are important. Those are part of what we do, but it's not the definition of pelvic floor therapy. And so we're still shouting that from the rooftops because there's a lot of misconceptions, and that's all we do. And hopefully, by the time we're done here, you'll see that that's not the case. This is just our disclaimer. We are not giving you personalized physical therapy suggestion. It's not actual medical advice. This is more general information. And if you want to take it a little further and work one-on-one with somebody, that's when you can go to a licensed health provider who specializes in treating pelvic floor disorders. So, I don't know if I'll read all of that, but this is who this information is for. Well, you're all in the club because you have a diagnosis of prostate cancer. You may have had prostate cancer treatment, but also you may be getting soon to receive treatments. So this is also, if you're getting ready for the hormone therapy, kind of some things to think about and ways to prepare for that so that you feel a lot more empowered when you go into it. Dealing with the side effects and those who just don't want to wait and see if it gets better and you want to actually do something about it. Because I think both of us have heard from a lot of guys, can I do something about this? I don't want to just wait around. What can I do? So this information is for you. So this is what we're going to cover. You will learn what the pelvic floor is and why it's important. Why does it matter to you? And what the heck does pelvic floor mean? How rehabilitation can help with some of these side effects from the different treatments. Some things we're going to give you, practical things you can do now to help yourself as you're going through the treatments, or even if you're 20 years post cancer, they can still be helpful. Then we'll talk about some resources and questions. Do feel free to ask questions throughout the presentation. We would love to answer that. This is no formal thing, so raise your hand, or however Steve wants you to raise your hand if you're online. That'd be great. So, what the heck is the pelvic floor? And I will say one thing, we will not make you get on the floor and do pelvic exercises.
You can make Rob do anything you want. It's fine. You're on up there. I already told him.
So I'm gonna have Trisha explain that, and we have a model.
Yeah, so this is my model, Ron. So your pelvic floor, while it's not just the musculature, that is a lot of what we focus on. It's basically the base of your pelvis where we have muscles, we have nerves, we have blood vessels, we have supportive tissues that help to close our openings, support our internal organs. It helps to stabilize the region. And actually, the pelvic floor is the base of your core. So lots of people think core and they think abs. Well, it's not the only muscle group. Pelvic floor is the base. And these are those muscles that we're going to focus on when we say Kegels. It is a pelvic floor contraction to help better control bladder function. These muscles are also important for erectile function. So we need these muscles nice and strong to help close off those blood vessels after we obtain an erection to help maintain an erection. They also help bring blood flow into the region. So it's an important muscle group, but as Laura stated earlier, we don't just do Kegels, but it is an important factor. If we actually, don't be alarmed.
I'm gonna stop the slides and point it to you here, because I just realized like it's not. Oh yeah.
Oh,
No, that's okay. Okay.
All right, so now I think it's.
Okay. And while you're doing that, what I can do here, all right. So from the bottom, I've just split Ron in half. As I said, don't be alarmed. But we have 3 different layers to these muscles. You've got the superficial, middle, and deep. And you can see if I remove bladder, prostate, and bowel here, they kind of create this bowl or wall, or some people call it a sling or a funnel within the pelvis itself. I tend to say the main muscles we focus on with the Kegel for bladder control are actually these superficial muscles at the base of the penis. We're going to get a bit more into how to do those contractions later, but essentially this is your pelvic floor. And you can see everything in here is in very close proximity. Okay, so we've got the bladder here. Prostate is under here for some people. Now for some people it's gone. And then here we have the rectum leads to the anus. Okay, so that's essentially your pelvic floor.
Any questions?
Do they cut any of those when they have the surgeries?
So this is where there is a possibility for some potential damage. We do know that within the prostate is the internal urethral sphincter. So when they take the prostate, that goes with it. And that's your primary mechanism of continence. That's how we maintain bladder control predominantly. So after a prostatectomy occurs, now we're actually focusing on the external urethral sphincter doing a lot more than what it typically did prior to surgery, which is why some people can be symptomatic with some bladder leakage issues and controls.
It's almost like you guys are made with 2 valves to keep urine in. Now they've taken away 1.
What's all sound?
Mainly.
Yes, what's the sound?
Uh-oh. Can you hear us now?
Yeah,
Yeah.
Are you there?
Okay. So then the pelvic floor becomes the main thing that keeps you continent. And we'll get a little bit more into that when we talk about prostatectomy, but I think it's helpful just to know, you know, what are we talking about and why does it matter and how is it related to the prostate and the bladder? Okay. Thank you, Ron.
You named him.
So if anybody's a Harry Potter fan, the other compatriot to this one is the female pelvis, and her name is Hermione. So it's Ron and Hermione. Gotta have fun with it, right? Keep things light.
Yep.
Let me get the
Okay.
slides back.
Okay. Share. Share. Share.
All right. So talk about the pelvic floor.
Next.
Next.
Okay.
All
All right.
Trisha talked a little bit more about the prostate and pelvic floor connection. And you kind of see that side view. You have the bladder there. And then right under that is the prostate, and kind of right under that is the pelvic floor. And so it does play a really, really important role. Once that prostate is gone, pelvic floor all of a sudden becomes a lot more important in keeping you dry and keeping that urinary control as normal as possible. It's all connected. So this is important to know because a lot of people don't know this. The pelvic floor muscles are skeletal muscles. That means they're just like the muscles in your biceps, in your abs, in your legs. They are under your control. Like if I want to move this muscle, I can do that. Your heart, your stomach, those kind of things, those muscles are not under your control. They're called smooth muscles. The pelvic floor skeletal muscles, therefore, they can be retrained just like any other muscle in your body. Does anybody go to a gym?
Daily.
All right. So you go there to retrain or to strengthen your muscles, right?
I have my weights right here.
Yeah. And any of the principles of training and fitness also apply to the pelvic floor. So remember that, and that kind of gives a new spin on it, that it's not some weird muscle different than anything else. It's just like any of the other muscles you work out.
Actually, my button here actually says orthopedics in a cave. So it's very orthopedic in nature, what we do. It's still bones and muscles and nerves. It's just in a little bit of a unique location.
Because there's nothing in the gym we do typically that's around the pelvic floor, is there?
Oh,
There's lots.
Oh, right, we're gonna get to that. Okay, all right.
Yeah. Wait, I think we're doing some work.
and another thing to know, and I'm just, for those folks here, I'm just holding a soda can. The pelvic floor is part of a system. And Trisha just mentioned, you know, it's part of the core. If you imagine the soda can, your pelvic floor is here. Your diaphragm, your breathing muscle is here. Your abdominals are in the front. Your back muscles are in the back. And, you know, this can't be a can without all the parts, right? Same thing with this whole system that includes the pelvic floor. It works with your diaphragm and your abdominal muscles. So we need to include the rest of the body when we train or strengthen the pelvic floor. That's why you hear us pelvic therapists harp on, don't just do Kegels, because they don't really work the whole core. And you need to include the rest of the body to get your best results. There's that pelvic connection, which is actually one reason why I renamed my business to that name.
Nice.
And that is, you see right there, just an illustration, and you can really see on that left picture. You see the spine, you see that kind of curve at the top, that's your diaphragm, and you see literally a line connecting it to the abdominals. And then you see that curve on the bottom is the pelvic floor, which connects back to the spine. So it's like a loop. And you need one to work the other. And then our good old soda can analogy.
How far up is the diaphragm? Like, okay.
Like the base of your ribs, a little bit under the base of your ribs. It attaches to your rib cage. And for those guys who know what a piston is, it's one of my favorite analogies. Think of the pelvic floor and the diaphragm as a piston. They both go up,
Together.
they both go down together. They should.
Ah,
So that's what we do, is help you figure out, are they doing this? Are they doing this? You know, are they moving together like they should? Because sometimes that's one of the reasons you might leak, is your piston is not working well.
we got a lot of broken pistons in here.
And those guys can relate to the piston.
Yeah.
analogy. And so, you know, it's like, we need to get your piston working.
I never heard this.
Yeah.
I'm so glad you're here. Okay.
All right,
Next.
next. So, Trisha, is it all about strength?
No,
No,
never is.
no. What is it also about?
Coordination, big time coordination,
Mhm.
knowing when to utilize the muscles, when to utilize your breathing strategies as you're doing your day-to-day activities, so that you can manage your abdominal pressure so it's not overpowering your muscles and your bladder.
Mhm. Also pressure management, yeah, coordination, the ability to work with the rest of the core, teamwork. I have a nice little analogy here of juggling. Now, I know my husband can juggle, but I can't. I'm terrible at it. But, you know, you can have the strongest person in the world, but it doesn't mean they can juggle. But the pelvic floor is like a juggler. Do you know? It's like a juggler. It basically is working to stabilize your spine, your pelvis, and all that, so that your arms and legs can move and lift and carry loads and do what they need to do. So, pelvic floor, that coordination, being able to juggle all that is super, super important. And that's one of the big things that we work with, or that a pelvic floor therapist should work with when they're seeing you. Pressure management, what does that mean? Trisha has a lovely demo here for that. I'll let you take
So
that.
technically, this is a little prolapse chicken. Um, so you can see this lovely little guy. He's nice and mobile here. But if when we are trying to coordinate our day-to-day activities and we're not coordinating our pelvic floor, our breathing, and our musculature well, what happens when we need to apply force and the pelvic floor isn't engaged? We end up creating too much pressure downward, and we can end up leaking with that. Okay, so I'll kind of walk around a little bit. So you see, we're not engaging that pelvic floor. It'll drop it down, and that's a lot of excessive pressure on the bladder. Common cause of leakage. But when we engage that pelvic floor nicely, it'll provide that support, and then that pressure is better managed. It's kind of like that, more of a solid soda can instead of having the top open or the bottom open. Got that support down below.
That's one of our favorite props.
Your props are spectacular.
told
I
you.
just, there's grade A plus here.
Oh, we're just getting started.
Yeah.
Okay.
We're just getting started.
Yeah, I got a few things.
Mobility. You all.
Yes.
He's right.
I'm in a meeting. I'll talk to you in a little bit.
So the pelvic floor muscles need mobility. They need the ability to contract, shorten, and relax or lengthen. And Kegels don't really emphasize that. It's just squeeze, 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 squeeze. It's like if you did biceps curls like this, how much would that get you? So that muscle has a length, it has a tension, and we need it to be able to do both. I think one of the problems that I see a lot is, especially if guys have had this problem a while, that these muscles get tightened up because there's the thought of, well, I need to just hold everything in, right? And that logically that makes sense, I'm just gonna tighten up here. Well, then those muscles get tight and shortened, and when they need to expand and lengthen, they can't. So we help with working on that. Same with the abdominals as well. Is they need to expand and contract as well, so you can breathe better, so your diaphragm works with your pelvic floor and your piston works.
Some of that movement, I would say, that can in part be your bearing down for like passing gas or having a bowel movement. You might also hear some people call it a reverse Kegel. So with that pelvic floor, to contract, it's kind of a squeeze and lift, then a relax, and then when you bear down or do a reverse Kegel, it needs to drop and lengthen. So those are the actions of the pelvic. We look at trying to balance this whole system.
No sound.
All right, so what I did with this presentation, there are some fairly common side effects of either of those three treatments. So I've listed those there, with the prostatectomy surgery, often some of the side effects are incontinence and erectile dysfunction. With radiation, and I didn't list all of them, but often you'll get urgency, frequency of either bladder or bowel, and pain. And I know sometimes people are told there's not going to be pain. Well, I think we've seen far too much of that. Often we'll have guys who are in horrendous pain that can be quite treatable with therapy. And then with the hormone therapies, you're basically thrown into a sudden menopause state with the lovely, the hot flashes and the fatigue and muscle a loss of muscle mass and loss of flexibility. And I don't know about you, but a lot of guys who come here, they're like, is there anything I can do through this? And you say the answer is
That's
yes.
me.
Yeah, there's actually quite a bit of research and evidence out there supporting strength training, for example, as a very positive thing for guys to do who are on the hormone therapies. And a lot of the other things, the fatigue, the loss of muscle mass, etc., that's something that not just a pelvic floor therapist could do, but, any orthopedic therapist as well could help with that. So we'll go on to some of the more common problems that we've seen and talk a little bit about that. So the big one, I think, for prostatectomy is incontinence. And Trisha explained a little bit about why that happens. Do you want to go into more detail about that?
I mean, sometimes there can be some adverse side effects just from the surgery itself. Maybe, maybe a muscle was accidentally nicked, and but again, predominantly it's that bladder support and that internal urethral sphincter that provided the continence mechanism previously. And then with the external urethral sphincter, for some men, it really didn't have a big job on its shoulders prior to surgery because it had so much other stuff creating the continence prior. So for some people, they don't even know how to contract the pelvic floor. And I would say that's a big one too, or maybe they're doing the exercises incorrectly. I do see that one quite a bit. So we have lots of aha moments in the clinic where people are like, oh, I finally got it. I got this contraction now. I will also say, and I don't know if you have this experience, but some of the new prostatectomy procedures have actually been more effective for continence overall.
Yeah.
So there's some newer procedures that have come out in the last 10 years or so, where instead of dropping the bladder in the pelvis, they keep it in place with all of its support structures, and they bring the urethra back up to the bladder, and they tend to have better results with that.
Other problems for prostatectomy is erectile dysfunction. And you see that picture there. This is actually Susie Donsky, who's another men's health physical therapist out in North Carolina. But you see all that network of yellow? Those are nerves. And there's an immensely complex network of nerves around the prostate. And nerves are like divas. If you touch them or just even move them, they get really, really, really dramatic. And even just moving those intact can be enough to have the system go into what they call neural shock and just check out. And so if there's not, the nerves are not functioning properly, then you don't have part of that function that you need for an erection. I'm going to let Trisha talk more about that.
Yeah, and what I can say is when the surgeons do go in and they are removing the prostate, they do everything they can to spare as many of those nerve bundles as they absolutely can. Unfortunately, for some men, the cancer has really kind of spread, and they do end up having to take some of those nerve bundles. But for some, everything can get saved. And some people kind of start to notice, I feel like there's a variety of things that we notice in terms of erectile function. Some people have really great function fairly quickly, whereas others, it can take some time for the nerves to kind of wake back up and figure out what they're trying to do. So I would say if anybody experiences that, give it some time. Definitely give it some time.
I've said at least 2 years for that just general nerve function to come back. Could be up to 2 years. Other problems, pain. And I've seen that with prostatectomy, radiation, even the hormone therapy, that can be a problem. And it's not across the board, and it's not with everybody, but that is something that we do address. I think it takes a lot of guys by surprise. I think sometimes it takes the doctors by surprise that, oh my gosh, you're having pain, you're not supposed to have pain. Well, you're having pain, we can help you deal with that. You know, that's one of our specialties, is dealing with the pain and then finding out, well, why is that happening and what are we gonna do about it? So if that is something you find out you're experiencing, you know, that would be a great reason to go seek out the help. Anything you want to add to that? Mhm. And then, a lot of this that muscle tightness, loss of flexibility, fatigue is one.
Pardon me a second, I gotta,
Fatigue, and those are all things again. Those.
I can't hear you at all.
yeah, just give me 1 second here, I gotta mute somebody. I've lost my participant list here.
You could just ask them all to mute themselves if they're just listening.
If I could figure out how I would do it. Zoom. Where's my Zoom? Where are my Zoom controls?
How can you get a baseline to figure out where your pelvic floor is right now?
Oh, I love that question.
Ooh,
I
excellent.
can't hear it, didn't hear it.
How can you get a baseline now to find out where your pelvic floor is currently relative to, okay, you're in good shape, you're bad shape, you're whatever.
I'm, of course, always a big advocate for coming to see one of us to have an assessment done even prior to any surgery. The hard part is people are told they have cancer, and sometimes all you can hear is the big bad C word. And so thinking about trying to do anything else can feel overwhelming, completely understandable. We can kind of teach people, I mean, even me personally, I can tell people how to do it, but I feel like really getting them in the clinic and fully assessing their capabilities, you're able to give like different cues that might help people and just spark just the right thing to see if they can actually contract appropriately. I do like to try people in different positions as well, because gravity can strongly impact your capabilities.
I will
It
say,
kind of depends on the person.
yeah, I often will do an assessment at the beginning to check that piston movement. And what I'll do, if you guys want to try it, and what I do is, like, you're sitting in a chair, you're sitting on your pelvic floor. And then I'll have guys do things like, okay, can you do like a little baby cough? Or maybe you pretend like you're blowing up a balloon. And you can try it if you want. If you're really blowing up a balloon, it's a little small balloon, you really blow it up, okay? Okay,
All right,
what do you feel down here? Do you feel pelvic floor pushing down into the chair? Do you feel it pulling up,
and when you blow, it pushes down, right?
pushes down? Okay, anybody else?
A little bit.
A little bit pushing down.
So what would we want to,
Okay.
what would we want to do that for?
Well, just think, when you're blowing out, you're exhaling,
Yeah,
and your diaphragm actually goes up. And pelvic
it would
floor
go up.
should
okay.
go up as well. So that's one way I can just kind of help people tell, or do they have any sense of what's going on? They're like, oh yeah, it pushes down, like, let's look into that a little bit more. You know, something off with the coordination, and we can start with that. You know, do you have a sense of what it's doing even? Could be good, can you?
I want to guess none of us have a clue.
Not
I don't know
until
how we would have
you're
ever known this, like it
in
just,
where people think they're doing things correctly, or they think they might have a
Yeah.
general awareness, and then there are other people who are like, I don't even know what the pelvic floor is. What is this? And I usually just tell people, you know, if you can focus on the base of the penis, focus on the scrotal region, even focus on the anus, even though most of our main focus is anterior in the front of the pelvis. You know, you can put a hand there. You can actually look at yourself in the mirror. You can mentally connect with that region and try to get a sense of, even if, do you feel any movement with your breathing? If you take a bigger breath, do you feel any movement there? Place a hand there. See, can you contract? Can you feel any type of movement in those muscles? And what's it doing when?
We'll go through some cues
Yes.
later.
Cool,
That's always
okay.
fun.
You just tell me you wanna go back to slides, I've got everyone muted. Okay.
I love the cues.
Okay. Sure.
So yeah, we talked about other problems. Anything you wanna talk about?
I would say this is an area I tend to see lots of deficits, is generalized mobility, flexibility, and strength deficits, even outside of the pelvis. Probably number one area I tend to see is glutes, your buttocks really having lots of weakness, and they're very important for bladder control. So I commonly have all of my male patients doing glute exercises, really everybody who could benefit from some glute and ab work.
So we're gonna talk about at least 4, maybe 5, just Trisha brought some stuff, things you can do now. If you're kind of wondering, well, this is great, what can I do? This is for you. You know, to retrain the pelvic floor. And again, these are suggestions that we give a lot of people. They work for a lot of people. If you want more one-on-one work, you contact us and see how you can, you know, work with a therapist or a trainer or something like that. It's system working again and reduce the leaks. So thing number 1 is, next slide, no, breathe. Learn how to breathe. And I always say the breath is your secret weapon. And a lot of my male patients do not believe that at first. And then after a few visits, like, oh my gosh, you are so right. I had no idea. You can use your breath to affect changing the pelvic floor with training. So this quote actually came from maybe a member here from a long time ago. It was either him or a patient of mine. He's like, Laura, I've got it. You got to teach all the guys this. Breathe deep into the balls. Like it works. I'm like, I'll take your word for it. So if you do that and you breathe, like your breath's going down deep into the balls.
Yeah,
Can you feel it?
yeah.
Okay.
And that's an exercise.
That can be an exercise activity to kind of get that connection between your breath and your pelvic floor. So, you know, breathing deep into the balls, can you feel that breath coming down toward the pelvic floor? That's probably the simplest cue I've ever heard.
I also like to
Yeah.
use lung imagery strategies, or, you know, as you're taking that deep breath in, imagine your abdomen and pelvis are filling with air. Again, it's that sump pump or piston mechanism. So as you inhale, those muscle groups drop. As you exhale, they then rise. So we're looking for that back and forth movement. And that can also not just help with your overall awareness of these muscles, but then you're automatically working on the mobility of your pelvic floor. And just so many added benefits. So you can even use this to help with urgency, suppression issues. So a lot of benefits to just breathing.
So for those of you who don't have a copy of this, this is a book I wrote about incontinence, but it also covers other areas. But this came from that book. I call it Exhale with Exertion. Especially guys who say, I leak when I get out of bed, or I leak when I stand up out of a chair, those positional changes. One question I learned to ask, are you holding your breath? And most of the time, yep, yeah, I am. Does that make a difference? Oh, heck yes, it does. So if you're holding your breath,
How would we hold our breath? Why would we Why would we?
I don't know, but you do.
It happens
It happens
all
yeah.
the time with
Yeah.
patients. I teach everyone how to breathe correctly. But again, if you're holding your breath as you're doing a transitional movement, there's that intra-abdominal pressure pushing down on that pelvic floor and creating that instance of leakage.
Huh.
So if we exhale with the exertion, essentially you're relieving some of that pressure from up above so that it's not going down into the bladder.
So I'm gonna have everybody try that. Even you all doing Zoom. If you stand up out of a chair, if you feel comfortable doing this, that's great.
Yeah.
Try and hold the breath.
I've never thought about breathing
Right,
before.
yeah.
I just naturally kind of do it, I guess.
So what?
Still
you
here.
know, one thing I teach is, go ahead and sit down, and when you stand up, all you need to think about, just exhale when you stand up. And what that can do is that gets the diaphragm moving up.
Exhale when you stand up.
That helps the abdominals activate. That helps. Exhale. Or exhale when you're getting out of bed instead of coming straight up in bed.
Yeah.
Which is a great way to increase leakage, by the way, and hurt your back and all that.
Exhale when we stand up.
Roll to your side, and when you're pushing up out of bed, exhale.
I strongly emphasize this one. This is a big help with stress incontinence. Exhaling during exertion, whenever you feel that you're having to exert yourself, even if it's mild. Some people might be able to get up really easily, but if you can exhale, you're gonna be offloading that pressure.
For example, lifting something.
Yeah, that's the one I've heard a lot
For
of people have the
example,
problem with is lifting.
what not to do.
Yeah.
Yeah. His back has been over, he's not bending his legs. He's probably putting a lot of pressure on the bladder. Versus getting down closer.
And then
Keeping
exhale.
your back straight, exhaling to lift up.
Gravity can take you down, no problem.
Yeah.
It takes effort to get
Yeah.
back up and push against gravity.
So that kind of brings it back to the question you had, Steve, about, how can we work on this at the gym?
Yeah.
When you're doing leg presses, when you're doing overhead presses, when you're doing bench presses or whatever, exhale on the hardest part of the exercise.
Okay.
So just as a general guideline, when you're doing the squats, which we all do squats, just did a squat when you got out of the chair. Exhaling when you come up.
So when we're exercising, the hardest part's exhaling
Mhm.
versus inhaling will get us the pelvic floor exercise.
It's gonna help to coordinate the muscles better. You're not necessarily doing a Kegel just by exercising, but you're getting some upward movement of the pelvic floor. You're gonna be engaging the abs a little bit, but again, you're not building as much pressure in the abdomen.
So it would
That's
help
the
with
big
incontinence and be physically beneficial. long
focus.
term.
Yeah,
Right.
absolutely.
Okay.
Yeah, and it may make the movement easier. I've had guys who have a hard time getting out of a chair. And we practice the exhale, with exertion, and they're able to get out of a chair and not even use the arms. So it can really make a difference.
Outstanding.
Just movement. Yeah.
Okay. Ready?
Okay, this is a fun one, and I'm not talking about that kind of tapping, but toe tapping. So for those of you who've had radiation, sometimes you'll get that urinary urgency, or even that fecal urgency. It's like, oh my gosh, I gotta go now. And this is just one strategy that I teach. There's multiple ones, but if you are sitting, just tapping your toes, one and then the other, for a little while, and that resets your nervous system, and it kind of helps your brain forget that the bladder's screaming at it so much, and helps things calm down. If you're standing, the heel raises or tapping the thighs.
Huh.
I know it sounds weird, but it really does work. I have one patient who he has found what has worked really well, because he had really bad bowel frequency. an urgency. And so when he has that, he does that on the way to the bathroom. And he's like, I can walk to the bathroom instead of running and feeling like a crazy man. And so just something simple like that can help with that urgency, buy you a little bit more time.
You guys have learned so much over the years. This is fantastic.
Yeah.
I'm so glad you're here.
Well, we love it. It's fascinating. Mhm. And it doesn't have to be complicated. That's the thing. This doesn't have to be complicated. You can use very simple things to affect big change a lot of times. Number 4, doing Kegels right. So we've kind of gone through the basic instructions, but this is one of our favorite parts. And this is audience participation.
Do you want me to turn the camera back on you? Or,
It
no,
doesn't matter.
not okay.
Basically, a Kegel is a pelvic floor contraction. And Trisha mentioned with Ron, Mr. Ron, okay? And I'm gonna bring
I'm turning the camera on if you're getting on out.
Yeah, and we want, yes,
Okay.
and we want Bradley, this is Bradley the bladder, by the way, we want Bradley to behave himself. And so we give different cues that are going to activate these muscles. They all do the same thing, but one cue is going to work for you better than the rest. And some of them are pretty standard, some of them are silly, some of them are really weird, but we have fun with it. So you can try the one that works best for you. The first one is pretty basic. Imagine that you have to stop the flow of urine suddenly. So that's one. So if you want to try it, go ahead. We're going to compare them and see what works best. So stop the flow of urine is one. That's one of the more popular ones. The second one,
Yes.
yes.
So my favorite is you're going to shorten the penis like a turtle pulling its head into its shell.
Don't worry,
you
it's not
imagine
going to
it?
actually happen, but
Well, we can actually get some penile shortening
Yeah.
because of the bulbocavernosus, but it doesn't stay there. So we shorten the penis like a turtle pulling its head into its shell.
so pull the turtle's head into its shell. That's the second one.
And how long do you hold it? How often do you do it?
That's a more detailed question.
Okay.
Mhm.
Right now, at the moment, I think
The
we're just
yellow
trying to
can
get
Okay,
the
ah,
yes,
contraction.
To get
Yeah.
the contraction.
We're gonna make sure we can do it first, and then I go into.
Yeah.
how
Mhm.
okay it is.
Yeah, are you able to do it? Or are you saying, I'm doing a Kegel and you're doing like this? You know, you're exercising everything but pelvic floor. Third one, I call nuts to guts.
Try lifting your nuts to your guts,
Yes.
or testicles to spectacles.
Or testicles
whatever
to
works for you.
spectacles if you have glasses. You're all pretty serious here now.
I know, I was expecting a little bit more giggling.
Let's see, do you have a fourth one?
Some of the other ones I might use is, imagine you're walking into a frigid body of water and you're trying to keep the boys out of it.
Ah, yeah.
Okay. And then my last one is more for when you actually have an erection, because it's the exact same muscles. If you've ever had an erection and you've been able to move the penis up and down,
Yeah,
that's the contraction as well.
I love doing that. I miss it so much.
Awesome.
Does anybody want to share what works for them?
Just wave it.
But again, the big thing with that anterior, so the front pelvic floor contraction, remember the urethra runs through the penis. So this is where we need the contraction to occur. Commonly, probably 99% of the time, my men who come in are not doing this. They are squeezing here, they're squeezing their butt cheeks, they're squeezing their abs, they're holding their breath, they're curling their toes, they're doing everything else under the sun, but
Mhm.
getting this contraction. And it can be much more gentle than you realize.
Yes.
I usually also, more for my female patients, say, imagine you're picking up a blueberry, not cracking a walnut. Because usually when you try too hard, that's when we start compensating. So if you find that it's challenging to isolate, you can just reduce the intensity
Yeah.
and see if that helps.
These are small muscles. So you're not working your quads. You know, they're a lot smaller. They don't need as much. Sometimes if you use too much force, you might leak more when you're trying to contract because you're overdoing it. So what I tell guys, most of you are like this. Okay, I'm gonna give it all my effort and more is better, right? Usually, it's like back it off 25%. And then you're probably in the ballpark. You know, what you think is a good amount of force, back it off, and you probably are in good shape. So more is not always better. So now that we know how to do a contraction, I just made this up. I call it Kegels Plus. You add the rest of the piston movement to it. So when you do the contraction, you're exhaling and you're contracting, pulling in the lower abdominals as well. So it becomes one movement, and then you're working diaphragm, abdominals, and pelvic floor. You're working the system at the same time.
Make it shorter and exhale.
There you go.
All right.
But
Yes.
again, on the inhale, make sure you
Yes.
release if you're looking for
Yes.
that good
Mhm.
mobility of the muscles.
You don't
With
want to just
this-
hold it tense.
Yeah, and we want some,
Mhm.
we need variability. We need to be able to do all kinds of things with these muscles. So you can really get creative with this.
Yeah. Mhm.
Back to slides, or Ron? Is Ron done?
I don't know what's on the next
Next
slide.
one.
so-
Okay, I better go back to slides.
Trisha's up on the next.
Okay, hold
one.
on. Yeah, sure.
Plus, and then next slide, there we go. Things you can do now, devices to aid in your recovery. You may have heard of some of these, I know Trisha brought a few, and just practical ways to actually use some devices to help you maybe in the first parts of your recovery.
So this is the Weisner incontinence clamp. This is for clearly incontinence, and there actually is a protocol that we do utilize for this. This can really be an invaluable tool to help build some confidence, retrain your bladder to do its job so it's actually holding the urine. It can increase your time between your trips to the restroom. And again, just provide that extra level of protection that not having it doesn't do. So while we're trying to retrain the system to do its job, this can be a very valuable tool. What I do love about this one, and I don't get any money out of this, okay, this is recommended by lots of pelvic health therapists compared to some of the other clamps out there because you can fit it to you. So it has these inserts that are different in size, different in thickness, okay? And so I believe this is the large one. So this one is going to apply more pressure, whereas a smaller one, it's less pressure. So you can adjust it based off of your own size and what feels comfortable to you. And you can also see if I can get this back in. It has that nice little ridge here in the center. And this is the piece that goes on the bottom. So if you remember, I said the urethra runs under the bottom of the penis. This puts a little bit more direct pressure in that area of the urethra while not putting as much pressure on the side. So it's not like the banana clamps that just squishes the whole thing. You get a little bit more specific pressure exactly where you need it. With this, I tend to use these for no more than 4 hours a day. 6 days a week. And again, when people come into the clinic, we work through the protocol itself. But with this, you can apply it as tight or as loose as needed on the penis to keep continence. Very, very helpful tool. The only time I've ever had people have any problems with this, like pain, is when they didn't listen to my instructions, frankly. So they were wearing it too long, wore it at night when they were sleeping, not okay. So.
And so this would be the way to get from the diapers to like a in-between period.
It's one of the tools.
Okay.
As PTs, we tend to have large toolboxes and we give you the tools to help yourself. And this is one of those very helpful tools.
Okay.
And for some people, I would say we don't always get them fully continent before they leave the clinic, because then they're going to continue doing their activities and exercises once they graduate. And maybe they want to go play around a golf with the guys, or they've got a whole lot of yard work to do in one day. This can be a really nice device to just slap it on and then not have to worry about it. Very, very nice. Amazon, 35 bucks.
What's that called again?
The Wisner incontinence clamp.
Wisner.
Feel free to take a picture once you're done. So for those at home, that is it. Take a picture real quick. Okay.
Go back to the slide here.
Now, the other thing that I brought is not for continence, it's actually for erectile function. I did bring a couple things. One is new to me. I'll go ahead and break it out since I brought it. This is Eddie by Giddy. I don't know that this would be an appropriate tool for anybody here. For this, you need to be able to obtain a full erection on your own. So commonly what I notice in my prostate cancer patients is that they have difficulty obtaining an erection as well as maintaining an erection. So if you are able to obtain a full erection and you're good there, but maybe it's difficult maintaining it, then this is a possible device. This is actually a sampling device, so, or a sampling set. Here, I'll open it. So this is the larger one, but we'll just use it. So essentially, it has these little nubs right here at the top. Okay, so these actually put pressure on the dorsal veins, which helps to maintain blood in the penis. And then it has these little rubber bands that essentially just go on this here to help provide a little extra compression. So again, it's just a compressive device to help maintain blood in the penis. So again, this is Eddie by Giddy, newer device to my knowledge. If you are a veteran, I can tell you that so long as you get, I believe, a script for these, the VA will cover these 100%. If not, I believe they're $188 for a 4-pack, and they request or recommend that you get one every 4 months. So it can be pricey and new device, so we'll see. The VA does cover these at 100%. They'll just keep sending them to you. Now this here is what's called a vacuum erectile device. So this can help with a variety of erection types, and let me explain that a little bit. So before any level of erectile dysfunction sets in, at night when you are sleeping, on average, you'll have 4 to 6 erections. And it's essentially your body and your nervous system exercising those erectile tissues while you're sleeping to prepare you for sexual activity while you're awake. Commonly, you might notice that last erection happening first thing in the morning when you wake up. So when erectile dysfunction sets in, whether it's just gradual over time, or maybe we have the surgery or radiation, those housekeeping erections start to decrease or go away. And so you can use this device to essentially exercise the erectile tissues. And then additionally, you can use an occlusion ring to help maintain the blood in the penis for sexual activity. This is the one I am most familiar with. Okay, so It also can be used for another purpose as well. This is a little bit of the fancier version. So some versions just have a hand pump. You will wear yourself out getting a hand pump, trying to do the housekeeping erections. I always recommend the electric pump. They do come with lubricant because you do want to lubricate the penis so it doesn't get kind of like stuck to the sides of the cylinder as you're creating erections. Do not use this on vaginas though. I do not know if this is vagina friendly. So if you're using this on your own, you can use that.
Do they make vagina-friendly lubricant?
Lots of vagina friendly lubricant on the market. Yes,
Okay.
very much so. So we just want to be nice to them. We don't want to include any irritants that might cause
Yeah.
some problems for your partner. Everybody needs to have a happy, healthy sex life, right? Okay, so with this particular device and all these medical grade erectile devices have their own kind of variability to them. This is the one I'm just most familiar with. So it has a nice kind of rubberized ring that goes on the end that creates the vacuum once you insert the penis. Okay, so I kind of use my hand as, or my arm as the, for instance, so it might be a little bit hard to see, but can you see how it's kind of pulling my skin into it? So what it does is it essentially creates a mechanical erection, and then there's a button on the back that then releases it. So very nice, easy to use device to help create erections so that you can have sex. With this, these are the rings that go, these are the occlusion rings that go at the base of the penis to help maintain blood in the penis. So, and I could show you how to use those if you wanted to, however, don't want to take up too much time, but this plus doing the exercises are easy, non-invasive ways to be able to still have a happy and healthy sex life. I have lots of gentlemen who use these who find them very helpful and effective. Did anybody have any questions on this? I know this can be a sensitive subject. So for a lot of men, it's actually very, very common for them to maybe after a surgery initially worry about, oh, well, what's my erectile function going to look like? And then they start having lots of leakage issues, and this kind of takes a back seat as they're worried about, oh, I'm wearing pads and stuff like that now. So, but there is help. Lots of men deal with depression and changes in how they view themselves just because of the erectile dysfunction. And so that's something to be aware of. And there's sex therapists and counselors that can help with that as well.
No, thank you, Sharon. I think that there is a very big knowledge gap, and because there's doctors aren't trained on it, they don't want to talk about it. Patients don't talk about it, and it's a big problem. And so I'm glad that everyone that has taken the time to be here knows that if they want to have a solution, there are solutions.
Absolutely.
And it's not going to be the same as it was, but it'll be still something.
Yeah.
Yeah.
You kind of work through what your new normal is. And I kind of joke with this. Sometimes it takes a little working out the kinks to kind of figure this out.
Yeah.
But once you get the right size for you and you really get used to it, you can go to town.
Yeah.
Okay.
Now I'm gonna add something that's a little bit different, but something that I'm finding, again, we're probably one of the people that guys have to climb and maybe that trust factor to really talk to. And one issue I'm finding is just with the pads. And what I call pad weaning. Or, okay, I'm seeing a few guys before their surgery, and they're like, what do I do? What do I get? I go to the store and there's all this stuff. And so we go through, what does all this mean? And just things like, okay, what is a brief? You wear those, and I always say, well, my doctor said I'll be fine. Okay, great. Just in case. You might want to have maybe a package of them. And usually I come back, yeah, I'm glad you suggested that. What do you do after that? there's no education on this.
And how to get off of them.
How you get off of them. So there is a pad weaning protocol in there from one of
In the
the
book.
leading therapists in Australia. And, but beyond that, well, what is a pad? What does that mean? I see something called a guard. What is that? I see something called a shield. It's basically a progression that you wear the pad, the brief or the adult diaper, and then kind of graduate to a pad, which is still not wonderful and it's still really thick, but you're not needing the diaper. Well, then what do? Then I suggest they go down to what is called a guard, which is more of a triangle shaped pad. It's a little thinner, and a lot of guys say, wow, you know what? I feel like I really hit a milestone because now I know I'm getting better because this is all I need. They're still wearing pads, but they're different and they're not as bulky and they fit in their pockets a lot better. Nobody talks about this stuff. And then going down from that to a little dinky tiny shield. And so, you know, there's a couple patients I'm working with now and we're trying to figure out, okay, well, what are you ready for? Oh, I'm going to go from a pad to a shield. Awesome. The next week he comes back. Yeah, I think I kind of overstepped that. Well, maybe we'll, you know, yeah, I kind of went through those shields pretty quickly. Well, let's try the guard. And so then they've got that step-by-step instruction on how they're getting into the pads and they don't have to rely on them all the time. And one thing I would just mention to people is, you know, if you are dry at night, you're still wearing the pad. Like, why? If you're dry 3 nights in a row, ditch the pad at night because you probably don't need them. And that can be terrifying, but also quite exciting because I really don't need them. And that's just one step. And I think just physically and mentally, it's super, super encouraging that, oh, wow, I don't need this right now. And then we can walk you through just, okay, how do you get from a pad to something less, step by step? So that's something that also isn't talked about that I think is a really important issue of, you know, how do you get out of these things? Yeah.
Well, thank you so much. Let's give it up for the ladies, please. I'm going to stop the recording. Recording.